Wes, it's a bit of a blur. I remember my gran picking me up.
You were driving?
What's with all the questions, man?
Well, I need to know if I'm going to help
Look,
you.
I'll tell you whatever you want. You just give me something first.
Yeah, Rosetta House is not far from here.
Look, you must have some painkillers for emergencies.
I hear their withdrawal program has a very high success rate.
Look, anything for hardest pills, you know, anything.
Yeah, the cramps, the cold sweats, it's nothing to do with the accident. You going through withdrawal?
Look, I haven't touched anything for days. I'm clean.
You should have told me.
I'd say just leave, yeah? Walk away.
I'm not abandoning you.
Yeah. Right.
I treat all my patients without prejudice, but I need to check on your grandmother.
How was the fire?
I managed to boil the kettle between power cuts, hear your favourite biscuits, and don't rush back because I've got everything covered.
What are you on about?
This had better be good. Calls himself a cross. He's nearly electrocuted himself twice.
I'll leave you two to it then.
How is he?
A little uncomfortable, but he doesn't seem to have any serious injuries.
This wasn't his fault. I want that to be clear. I might be old, but there's nothing wrong with my hearing.
Did he finish the program?
Really tried this time. When he phoned, he was so desperate.
You wouldn't drive him to his dealer, but you gave him the keys.
So you see, the crash wasn't his fault. I shouldn't have let him drive when he was so distracted. A little thready, isn't it? I was a ward sister for 25 years. So I know what you're thinking. Weak pulse, pale complexion. Is it just shock or something more serious?
And the answer is? I'm going to need to take a closer look. Oh, Jane, you should have told me.
Kenny needed you more.
Okay. But if it gets worse, you're to let me know, all right?
Dr. Carter, if I don't make it, I want you to tell Kenny's parents. I need to give him another chance.
You can tell them that yourself.
I got a signal halfway up the hill.
See? Help's on its way. How long are they going to be?
20 minutes, minimum.
God, they better put their foot down. She's losing a lot of blood.
What can I do?
Hey, I'm in pain here.
I'll stay with Jane. You can monitor Kenny until the paramedics arrive. You need to be aware of his drug seeking. He's an addict.
Right.
Where are you going?
My books, they're in the car.
Well, you're not cramming for an exam now. You have a real patient in real pain. Go!
Pain.
I've told you, we don't carry any drugs.
For him to pass, it's a good shot.
It's all in a good cause.
I can't breathe. I can't breathe. What's that? Tell me. What?
Excuse me.
You all right?
Yeah, I'm feeling a bit lightheaded. I was trying to skip breakfast.
Dr. Carter! His breathing's deteriorating. He's become tachypneic.
Have you checked for hemopneumothorax?
No, sorry. Doesn't seem to be any blood in the lung cavity, and his lung isn't collapsed either. Part of his left side's moving out when he's breathing out.
I concur.
Flail chest.
What's that?
This is what your ribcage should look like. But a section of the chest wall must have broken free in the crash and become detached. This is now moving independently. It's this paradoxical motion that's causing your breathing problems.
Look, I won't pretend this isn't serious, but you will be fine as soon as we get you to St. Phil's.
Dr. Carter, what's happening?
What do we do? I've never seen a flail segment before.
To intervene is risky, but it's the only chance he's got. If we do nothing, he could die.
But we need x-rays, anesthesia, a fully equipped...
Yeah, I'm afraid it's just you, me, and our wits.
No, 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 don't do this to me now. No.
Right, I won't lie to you. This is gonna hurt.
Just do it.
Right, I'm gonna push in the rib. Once it's in position, we have to apply a constant pressure to keep it in position.
Okay.
Right, I've got to do this.
Ah! Phil, it's pain too much, too much.
Carter,
I can't do it.
you must have done hundreds of procedures.
That was before.
Before what?
In the middle of a laparotomy, I first noticed the symptoms. Lightheadedness, tightness across the chest.
Myocardial infarction.
Varicose veins, endowed plans, that's my world now. Anything more strenuous could bring on another attack.
What about Kenny?
You're gonna have to do it.
But I can't.
You've done a surgical rotation.
Which I scraped through by the skin of my teeth. But ask me anything about diseases, infections, no problem. Mind like a medical encyclopedia, but I don't do emergencies.
I've got a choice.
But
I'll talk you through the procedure. You've got to do it. I've got to get back to Jane, or we could lose them both. Talk to me, Dr. Bond.
it's impossible.
Be calm, focus, and press on the ribs.
But he won't listen.
You need to do this.
He keeps moving.
Please, you've got to help him.
Oh, I can't leave you.
I can manage. Please, Dr. Carter. Kenny needs you.
I think he's becoming more hypoxic.
Please, Dr. Carter.
If you're sure, keep up the pressure. Be as quick as I can. Kenny, listen to me. I know it hurts. You've got to keep still. It's the only way. Now, apply the pressure evenly.
Ah!
No, keep going.
It's not working.
Why don't you stop panicking and remember your training?
It's working. I think I've done it.
Right. He's pinking up. Keep the pressure on until the paramedics get here. Get him stable.